We recently had a comment on the abbreviations and terminologies in the UK's healthcare system for the different medical job titles and examinations. Honestly, this tends to be really confusing and overwhelming for those who are new to the UK's healthcare system, especially for IMGs. In this video, I'm going to discuss the different job titles used to refer to the doctors in training. In the Philippines, we know that the usual setup in a training hospital looks like this. First, we have the clinical clerks or junior interns, then the senior interns or postgraduate interns, then the residents, followed by the fellows, and finally, we have the attending physicians or consultants. Now let's talk about how it is in the UK. For doctors in training, job titles or positions are referred to as grades, which are FY1, FY2, CT1, CT2, ST1, ST2, ST3 to 9, and post-CCT. The letters reflect a doctor's job title in a particular training program, where FY stands for Foundation Year, CT for Core Trainee, ST for Specialty Trainee. The number indicates the year of training the doctor is in, where ST2 means that a doctor is in the second year of specialty training. Let's explore these terms by discussing the training progression in the UK. To begin, after completion of medical school, graduates enter into the UK Foundation Program, which is a 2-year training program that serves as the bridge towards practicing as an independent doctor. Doctors at this level have the job title of FY1 or F1 and FY2 or F2. A foundation program certificate of completion is awarded at the end. Next comes specialty training. Generally, there are 2 training programs, which are Uncoupled Training and Runthrough Training. Uncoupled training means that a doctor must first complete 2 to 3 years in a specified core training before proceeding into a higher specialty training. Core trainees are designated as CT1, CT2, and CT3. Core training programs include the following: Acute Care Common STEM, Core Anesthetics Training, Core Medical Training, Core Psychiatry Training, and Core Surgical Training. Among the 5, only Acute Care Common STEM is a 3-year training program. These are the specialties that a UK doctor can get into via uncoupled training: anesthesia, emergency medicine, intensive care medicine, medicine and its 29 different pathways, psychiatry, occupational medicine, pediatric cardiology, pathology, specifically metabolic medicine under chemical pathology, and surgical fields except neurosurgery. The designation for those in the first year of higher specialty training through uncoupled training programs will continue off of the number of years in core training. For example, after completing CT1 and CT2 in core anesthetics training, the doctor will then have the title of ST3 in the first year of higher specialty training in anesthesia, which is completed in 4 years from ST3 to ST7. It's important to know that completion of a core training does not automatically grant a spot for higher specialty training, and that one must apply for it. On the other hand, run-through training means that a doctor will only need to apply once until completion of the required number of years in training, and the designation starts at ST1. There is still a higher specialty training which typically starts at ST3. Run-through training is the scheme for the following specialties: clinical radiology, community sexual and reproductive health, obstetrics and gynecology, ophthalmology, pediatrics, pathology, specifically chemical pathology and histopathology, and neurosurgery. There is also a run-through version of emergency medicine that begins in ST1, and likewise a run-through version of trauma and orthopedic surgery that incorporates core training. Going back to core training, what you will see next are the specialties sorted into the programs that can be used as prerequisites. A lot of these specialties are not restricted to only one specific core training. It's best to visit this website, which is linked below, to find out more which core training is for a specific specialty. You may be wondering why general practice training was not mentioned. That's because it has a separate structure of training altogether and will not be discussed in this video. So what comes next after completion of a specialty training? At the end of a specialty training, doctors are given the Certificate of Completion of Training or CCT and are recognized as consultants. Afterwards, they have the option to pursue further training in what is known as post-CCT fellowship, which is also known as subspecialty training. You may have heard of these old terms that were earlier used to refer to the job titles that we discussed. House officers or HOs are now called the Foundation Program Doctors. Senior House Officers or SHOs are now the junior trainees in core training or those in the first 2 years of specialty training. Specialist Registrars or simply Registrars or SPR. These refer to senior trainees who are ST3 and above. And that's it. Thank you for watching.